Welcome back to Free My Pain Now with Dr. Matt Duro. This is episode 24. Thank you so much for our listeners who've allowed us to stay on. Jeez, we're in 2020 now. Very excited. Hey, listen, brings up a good point. If you like our podcast and you would put a review in for Apple iTunes, it helps other listeners find us. So thank you, and be kind to your neighbor and on your reviews. So listen, today we have a special couple doctors coming on from Nutley, New Jersey. They're going to be on the second half. And we are going to be chatting with them. It's Dr. Marco Ferucci and Tim Lyons. I think Ferucci he's Irish. I'm not sure no, he's Italian. He's a good guy. I know them both. They were students back in the day with me 10 years ago. 11 years they've been out. And wonderful practitioners. They're going to be getting one of the stem cell machines. So January 18th, we will be delivering their unit. And they're going to be, I think, one of the first in New Jersey. I'm very excited for them. But I'll also be speaking at their event. It's January 18th. It's a Saturday at called the Chiropractic Source. That's their clinic. So if you're in the New Jersey area and you want to come in and experience the stem cell machine and what it's like, they're going to have an introductory offers and specials. And if you're in Atlanta area, because we do have our radio show here in Atlanta, you can always go to ATL Pain Institute. That's our local clinic here. Cool thing, Sam, is we are getting patients from all around the Southeast.
That's excellent.
We had a young lady fly down from Baltimore, Maryland last Friday. Pretty cool. We had a couple that drove in from, Nashville, Tennessee this morning. It was pretty cool. Another physical therapist that came up from Orlando, Florida, just after Christmas. So we're getting our feelers out there. People are starting to, they want to learn more about this. And we've got a couple YouTube pages, I guess, or channels. One of them is Free My Pain Now with Dr. Matt Duro, or Free My Pain Now. And then the other one is Dr. Matt Duro. The Dr. Matt Duro is more for practitioners, and it's learning how to use the device so they can become more proficient in utilizing this and getting the best results. And so pretty excited about that. That's fun that we have those to offer. The Free My Pain Now actually has our podcast, but also has different patient interviews and testimonials and what we're doing. It's funny, we were talking about Dr. Joseph Cipriano, who was one of our guests, I think, episode 15, 16.
A while back.
Yeah.
Good one.
I have a photographic memory. So
all right.
No, I'm just kidding. But what we noticed with him, and it was great to have him not only as a guest, and he's doing some amazing work up in Greenville, South Carolina, but he's now has over 1 million subscribers to his YouTube channel. And the one thing that he said to us was, hey man, I can't believe how many testimonials you have, real testimonials from patients. But he said, the only thing I would say is I would get some of the clips of what the patient is experiencing. Like, what are the symptoms they're going through? And he said, get some video there, and then also show the treatment. And I'm like, dude, it's painful. He goes, that's okay. I mean, I think that's what draws their viewers, because he does that Y strap, right?
It's very sudden.
He almost pulls the head off the...
It's what you think's going to happen for a second.
Everybody watches it to see that, I'm pretty sure. But he's a very well-trained practitioner, and he's done hundreds of thousands of those. So pretty cool. But nobody's head has popped off yet, thankfully. But he has over 1 million subscribers. And he said, listen, so clip together the symptoms, the patient telling about their problems, what activities of daily life they are not able to do anymore, and then show the treatment, a little screaming, yelling. Remember, you have to feel it to heal it. And if we run it over normal tissue, no pain whatsoever. And then he said, show him, get up and walking around. And we were only doing the last part. Like this is such a transformational type of therapy that we were like, we got to start videotaping this because people aren't going to believe it. So, we were videotaping the patient's response afterwards. Now we're starting to do the whole gamut and really look at what's happening. Have a wonderful young lady, Miss Nell, that you'll see on Free My Pain Now on our YouTube channel. She's no longer using a cane. I mean, we've had like 2 people go from walkers to canes to nothing in the last couple weeks. So it's been a nice way to kick off 2020. And, we have a wonderful young lady on there who is chemo-induced peripheral neuropathy. We hold a special place at our clinic for any patients that are going through chemotherapy. And, not only were they diagnosed with cancer and the terrible debilitating side effects that go along with it, but, now she's not able to walk. She actually has foot drop. So we have really one of our second ever patients who went through chemo and our treatment at the same time, Miss Claudia. She'll be coming on as a guest in 2 weeks. She's coming all the way from Reynolds Plantation. So we're really excited to have her. And she's going to share her story because she was going through chemo and utilizing our therapy, which we have actually patented the use of the polychromatic lights and the stem cell machine to treat diabetic and chemo and peripheral neuropathy. So good stuff out there coming down the line. In a couple seconds, we're going to call in and we're going to talk with Dr. Tim Lyons and Marco Ferucci. Okay, so on the phone, I have Dr. Marco Ferucci and Dr. Tim Lyons. Welcome, gentlemen.
Hello, how are you?
Hey, so excited. I already was explaining to our listeners that you guys are getting a OrthoGold 100.
Yes, we're excited.
Congratulations. It's nicknamed the stem cell machine by the show The Doctors. And so, let's walk through this. This is really big. We've got some good things to announce. We're going to be having the device by January 18th in Nutley, New Jersey. Tell us the name. You're the chiropractic source, correct?
Yes, it's going to be actually in Cedar Grove, New Jersey.
Okay, Cedar Grove. Sorry.
Yeah, so it's going to be located at 388 Pompton Avenue in Cedar Grove, and we're going to be doing a demo with you here, showing the device and giving great education on the importance of it and how others could benefit from this type of machine.
Yes, and how did you find out about this device?
Just through our research of just finding the best modalities for soft tissue injury that, sometimes we have patients that are doing great and they just have the soft tissue injury that's just nagging and just, you just can't figure out what exactly to do to help it. And then just through our research and then having a background understanding, where you come from as well. We've known you in the past. We touched base with you and got a great understanding of how beneficial this could be, not even just for the soft tissue injury that we were looking to help, but even other, problems that we can help with, with the diabetic neuropathy and those type of things, which is a huge attraction for us as well, especially, me having type 1 diabetes. It's a demographic I would love to help.
Yes, you're not only a doctor, but you're a type 1 diabetic. And, I think you got sick of seeing all my Facebook stuff, right? You kept seeing me post things and you're like, gosh, just let's buy one of these just so we don't have to see anymore.
I think we initially had a conversation like a year ago or something about it.
Mm-hmm.
We finally decided to make the move just with all the more research that we did. And, we were wanting to get a laser, the cold laser in to start treating patients with that. And the more we learned about it and the more we talked to you about what, the shockwave therapy can do, it didn't really make sense for us to go in that direction. So we we're moving in the direction of doing the shockwave, which I think is obviously a lot more versatile. It seems like, and it's a lot more effective. So
Yeah, and I say, about nothing against Class 4 lasers because they've done some wonderful things, but I do say they're so 2000 and late. They're last decade. We're in 2020. This is a futuristic device, and much like what you used to see on Star Trek, right? The tricore medical scanner, it can diagnose. If you run it over normal tissue, no pain. As soon as you get to an area of inflammation, patients are like, right there, that's it. So
right.
we're gonna break for just a second and come right back. But in our next segment with Dr. Marco Ferucci and Dr. Tim Lyons, we're going to talk about your event in January 18th and what we're doing in your community to make it healthier. Welcome back to Free My Pain Now with Dr. Matt Doduro. And today we have two other wonderful doctors, Dr. Marco Ferucci and Dr. Tim Lyons. I also knew you gentlemen when you were young, aspiring students. And I think Tim was an actor as well, wasn't he, down here in Atlanta?
Yeah.
Tim he's got a good look. The Walking Dead down here, didn't you? Weren't you like something on that, didn't you?
Oh, I think you're thinking of another Tim.
Oh, okay. No, Tim. But seriously, really excited about bringing this technology. I'm pretty sure you guys are going to be the first group in New Jersey, other than a urologist, to have this. So kudos to you both for having the vision to see the technology and how well this is helping other people. And the cool thing was you guys were able to come up to Staten Island where we were with Dr. Weena, and you got to see how the device works and experience yourself. You both got to try it. First, I'm going to start with Tim. Dr. Tim, what did you notice after using the device, after we tried it on you?
So I have to be honest. I'm not really in a lot of pain anywhere in particular. I did have some tightness in my lower back a couple of days prior to using the shockwave therapy that day. So we used it on my lower back, and there were definitely some sensitive areas for sure, like around my SI joint and my upper glute. And I just, afterwards I felt pretty loose. Like I said, I wasn't in a ton of pain, so I can't really say anything dramatic happened when I used it specifically. But you could definitely feel the areas where there was sensitivity, which meant, there was definitely some tissue injury where we were going over. So, we used it that day along with some other people who were there, and you could tell that it definitely helped. So, yeah, that was my experience the day that we went over the first day. So.
Dr. Marco, one of the cool things about when we're working with diabetics is we notice for every 1,000 shock waves, we see a 10-point reduction in blood glucose. And you have a constant glucose monitor, correct?
Yes.
Not that we saw any dramatic changes in your glucose levels, but that's in the next few years, that's where some of the research is going. What's happening, right? How are we burning off glucose that's, excess glucose that's in your bloodstream, and how we're utilizing that during the treatment. It's going to be fun to see. As you both know, in the middle of December 2019, the FDA came out with Class 2 clearance for this device. So now we're actually approved to work on wounds and diabetic ulcers, which, our prediction is that we will save hundreds if not thousands of amputations for diabetics. So, and be preventative, right? Let's look at, the way diabetics work is the higher your blood glucose goes, the thicker the viscosity of your blood gets, and the thicker the blood gets, it can't get into those smaller capillaries and arteries. like those in your eyes and the tips of your toes. So, a lot of diabetics go blind, and they also have a lot of circulation issues. So I'm excited not only to bring this technology up to you guys, but I'm also excited about showing you our protocol to treat diabetic neuropathy. And 33% of the population is diabetic, and I guesstimate another half of the population is probably pre-diabetic.
Yeah.
So, Doc, talk to us about some of your struggles and what you had to do. This is really about becoming your own healthcare advocate. You were a healthy guy, and all of a sudden, boom, you got type 1 diabetes.
Yeah. So my story, is unique because most type 1 diabetics get diagnosed at a very young age. And for me, I was 32 or 33. I forget exactly what it was, but it was 32 years old. So it was a very different, diagnosis path. And so for me, that just shows me that it's definitely an autoimmune approach, towards type 1 diabetes because, I never had it, and then I did. So something happened in my body. So I did a massive amount of research and what best diets and supplements and stuff. So I'm on a very unique dietary protocol and lifestyle that really keeps my blood sugar low, and it's with minimal amounts of insulin. So to be able to promote that type of lifestyle and be able to bring in, a device like this where we could improve their circulation and go that direction as well is it's extremely beneficial for our patients in the future.
Yes, and the FDA has cleared this to help decrease pain and improve circulation. And when you guys asked me who do we get for this event on January 18th, I said, hey, get all of your patients that you love, that have been with you for the last 10 years, that still have some chronic nagging underlying issues. Maybe it's a frozen shoulder, maybe it's plantar fasciitis, maybe it's a golfer elbow that's reoccurring, and we're going to get them all over there January 18th, Saturday morning. Give the address again, please, Doc.
388 Pompton Avenue in Cedar Grove.
Pompton, and how do you spell that?
Pompton, Pompton Avenue.
Excellent. All right, so that's awesome. So we're going to get a good group out there. We're going to do some training. We're going to have some fun. One of the things that I really enjoy about what you guys have built up there in New Jersey is you are known for corrective care. And, some of our listeners might not know what that means. So, explain a little. There is we've talked about what a normal posture is in the body, the ideal spine. There is a normal blood pressure of 120/80. There's normal temperature. So what do you guys do that's different from any other chiropractors out there?
Yeah. So chiropractic biophysics, shortened to CBP, is the technique that we do, and it is unique in even in the world of chiropractic because we do take a structural corrective approach. So it isn't an adjustment and then they move on with their day. They're doing a rehabilitative program that includes also postural exercises, as well as a postural stretch in the office that we call traction. And it's all specific to their findings. So every person comes in and does a postural picture and digital x-rays, and we're analyzing it compared to what we know in the structural world as being normal. So that is very different for what a lot of chiropractors, do with their patients. Some just adjust the spine and move on, which is nothing against that, and it's a great approach. And the adjustment is one of the most powerful things you do to the body, but they also need the structural rehab on the muscles and ligaments to correct it permanently. So that's an approach that we take in the office, and makes us very unique. And then bringing in this device is going to make us even more unique. And there was a concern when looking into this: is this going to take people away from the structural approach? Because if they do become pain-free from this device, are they going to still desire to change their spine? And that's, that was something that we struggled with. But we believe that it's still a great thing to bring in the office, and we're excited to do that.
Well, yeah, and I mean, anytime you bring in a new type of device or technology, you're not sure how how to put it in the flow. But I really feel that, and I spoke to another CVP doctor last night, who's in Staten Island, Dr. Mike Romagnolo. Is that yeah,
We know him.
wonderful guy. Same thing. And my prediction was this: I said, Dr. Mike, I believe that utilizing this type of therapy, lithotripsy, with your corrective care and tractions will help really speed healing, reduce the number of visits, and decrease the traction time that patients have to go through to correct their postures. I mean, you think about the generation right now, and you look at them when they're on their iPhones and walking and their neck is bent and tilted. And yes, that's right. Dale's doing it right now. It's an abnormal stress on our nervous system. So, we've got about a minute and a half. Dr. Mark or Dr. Tim, please give us some tidbits that our listeners can do to start taking some stress off.
I mean, you mean for like tips for at home, or?
Yeah, everyday life.
Yeah, I mean, being aware. I mean, once you start talking about posture with people, and especially when you show them posture, one of the biggest things that we notice from our patients is they become more aware. And if they just become more aware of how they're sitting at their desk if they're at a desk, or when they're watching TV at the end of the night when they're relaxing, or when they're driving in the car, like all of the things, like when we point out what their structural posture looks like, and then they're like, oh yeah, I went home and I noticed the way I sleep, and in my bed, or when I was watching TV, I was leaning towards the same side he told me I leaned to. So trying to become more aware what you're doing throughout your day, and then obviously limiting, the amount of time you have to be on the phone and the computer. That's, obviously something that is going to put us in that abnormal posture for a certain period of time. So those are the types of things we try to initially tell people. But, the best way to do it is just to get the proper evaluation from the right type of doctor. So finding a structural corrective doctor is the best way to really start in the right direction.
Well, thank you. And we, all three of us, are sitting up very, very straight right now. So, hey, Dr. Tim, thank you so much. I look forward to seeing you guys in a couple of weeks.
Absolutely.
Thanks a lot,
Thank
Doc.
you so much.
Appreciate it.
All right. Peace.